If you're having a baby and you're in South Florida, bring me your baby. I would love to take care of them. We're gonna talk about newborn care today. So basically, if you're having a baby, congratulations. Babies are always a blessing. I've never seen it any other way. I'm super excited for you if you're in that situation. My favorite thing ever. That's why I became a pediatrician and I love to do it. So today we're gonna do an informational video about what the hospital will offer to your baby after your baby is born. So there's a couple decisions you have to make. In the hospital, they will offer you a hepatitis B vaccine, a vitamin K injection, erythromycin eye ointment, and a newborn screening. So let's break every single one of them down and talk about them one by one. How could a baby get hepatitis B? What is hepatitis B? Hepatitis B is a virus that infects the liver. There's a few different viruses that humans are vulnerable to that infect the liver. Hepatitis A, hepatitis B, and hepatitis C. We only have vaccines against hepatitis A and B. So today we're talking about hepatitis B. Hepatitis B is a virus that infects the liver. The liver is located in your abdomen on the top right quadrant of your abdomen. Your liver's function is to clear and rid the body of toxins. So you can imagine if the liver is infected and your body cannot clear toxins, body is not going to function optimally. That's hepatitis B. Let me tell you how a baby could potentially get hepatitis B. If a mother is infected with hepatitis B, the baby could potentially get hepatitis B during the birth, whether vaginal or C-section, because the baby would be exposed to blood and bodily fluids. Another way a baby could get hepatitis B is from a caregiver or someone in the home. So if somebody in the home has hepatitis B and they have a minor cut or wound or got a spot of blood on a surface, the baby could potentially come in contact with that virus. Babies put a lot of things in their mouth. If you don't know yet, you will know that humans learn about their environment from putting things in their mouth. You do want your environment to be free of pathogenic viruses and bacteria. There's always going to be viruses and bacteria in our environment, but importantly, you don't want the really bad ones living in your home, right? Hopefully we know if those viruses are living in your home, but sometimes we don't. You know, medicine is advanced, so mothers can get screened. And that's a wonderful, beautiful thing. You have the ability to be tested for hepatitis B before you have a baby. If a mother is hepatitis B negative, test negative, there's far less chance you would transfer hepatitis B to the baby at birth. Though the risk is not zero, testing is not perfect. Other ways a person could get hepatitis B is in a needle stick injury. So more common in healthcare or more common by accidental exposure, like playing with a needle, which there's so many needles now in our environment with all the new injections of peptides and things. Children, I have had in my practice that children have been exposed. Risk is not zero. Okay, when is the vaccine recommended? So currently the American Academy of Pediatrics recommends giving a birth dose and then another dose at 1 to 2 months and then a third dose at 9 months old. And then that would complete your hepatitis B series. Some people now, when they have full prenatal care and mom tests negative, are choosing to delay that hepatitis B vaccine. If you choose to do so, we always have the vaccine available. Most pediatricians will always have that vaccine available. So it's just something to talk to your healthcare provider about. The next thing I want to talk to you about is vitamin K injection. The vitamin K injection is going to protect your baby from bleeding. Vitamin K is an important part of the clotting pathway in a human's body. And if that clotting pathway doesn't have vitamin K, it will not work optimally. So why would it matter? Why would a newborn need to clot? Newborns have thin vessels in their brains, and so unfortunately they are at risk for bleeding, and a most severe bleed would be a brain bleed. There are right now 2 different ways to give vitamin K. There is an injection and there is an oral vitamin K. In the US and in the state of Florida, we give vitamin K injections at birth. That protects you against early and late hemorrhagic disease of the newborn. Fancy way of saying brain bleed. If you do oral vitamin K, you will only protect the baby against early hemorrhagic disease of the newborn. So basically you get more coverage with the shot. The other thing I want everyone to know before they leave the hospital with their baby is that you can't get this vitamin K injection anywhere else. I don't carry it. Pediatric offices don't carry it. Urgent care doesn't carry it. The other clinics, like the travel clinics, they don't carry it. So this is a decision I want every parent to be informed about before they leave the hospital with their new baby is, are you getting the vitamin K injection? Because when you leave, you don't really have access to it anymore. Next, the erythromycin eye ointment. So this is an antibiotic ointment that we wipe on a newborn's eye, and this ointment is going to protect the baby against gonorrhea and chlamydia infection in the eye. It's also nice that now we test moms for gonorrhea and chlamydia. The reason we give the erythromycin eye ointment in the US is because should a baby come through the birth canal and be exposed to gonorrhea or chlamydia, especially gonorrhea, there's a high chance of very rapid infection of the eyes leading to blindness. So such a high risk problem and such a low risk intervention that it's a universal recommendation that all babies just get the eye ointment because we are potentially preventing blindness. Lastly, we have the newborn screening. The newborn screening is a way to test newborns for rare genetic diseases. In the state of Florida, they will prick the baby's heel and then take a piece of paper and put 5 dots on the paper. The blood will dry and we will send it off to the state lab, and the state lab will screen your baby for rare genetic diseases. Things such as cystic fibrosis, sickle cell disease, hypothyroidism, PKU. So the reason we do it is because if we know early, with early intervention, the child will have a much healthier life. So this is your newborn series. I hope you enjoyed it. Again, if you're having a baby in South Florida, I would love to see you. My name is Dr. Biggie, and nothing brings me more joy than taking care of kids.